All right, so that's the official wrap up for the YouTube video. Now we can go for the less formal Q&A with people asking questions. I know Chuck's been Chuck Workflow. I think that's his last name or his middle name, right? He's been putting a lot of questions. Let's see. He said, you see Fire being used to pull together structured documents to be sent via direct.
I'll answer that. I see anything being used to pull structured documents. Those are actually somewhat mutually exclusive questions. Direct's just a way to get information around. So however you pull your documents around or pull your structured documents, Fire could definitely be one way to do it. I've seen some technologies out there that have done brokered queries out there via Fire to pull information into one place. Absolutely, you could definitely use that then to go generate a direct message.
Interesting. And he said, can you send anything with direct? I mean, he noted blobs or other things. I mean, is there limits on what you can send with direct?
It's really size limit. I mean, if you think about what you can do in a browser or with HTTP, I mean, I'm getting into the technical weeds. It's all based off of MIME types. That's all email is. It's all based off of MIME types. Anything you can define as a MIME type, you can send it. Actually, in theory, you can send anything. There's other types such as application octet stream. So I think size is more of an issue than anything else, and that's where it starts to get down to the use case. If you really just need to send a quantum type piece of information, or are you trying to stream large amounts of information?
Yeah. But generally, direct is payload agnostic.
Yes, it's absolutely payload agnostic.
PDF.
And what's interesting is that it's not a direct limitation, but we found that some EHR implementations have limited it. And so that's a little bit of a frustration because we're like, okay, we want to be able to move, more than CCD type information back and forth in some cases. So some implementations have limited, again, not a direct limitation.
You get 100 likes for that one.
That's we see Greg blowing you up.
That gets back to my point earlier that I said, unfortunately, a lot of people see direct as transitions of care. A lot of folks have actually implemented direct as transitions of care, but that's really not direct. It's just a use case.
That may be their first direct address of many to come.
That's okay. Whatever gets them in the game, and I think it's a great way. It's a great place to start.
Well, I think that's, it goes back to some of the EHR discussion we have. Sometimes you need the foundation, you need the endpoints connected, and then you can expand to other use cases, right?
Yep.
Or they can just implement Julie's technology, which supports any payload. Is that right?
We don't. Our protocol doesn't restrict the payload type, but even our customers can if they wish to with the API.
Well, I have a systemic glove for you now, Mark. I'm not even clicking on it anymore.
What's going on there? That's great, Greg.
Yeah.
You're on permanent prop from Greg because you made such a good comment.
Somebody's finger got stuck. Who knows?
That's good. Andy Michael asked.
It's all beta.
Yeah, exactly. He asked, can direct be implemented in encoders? And I asked what he meant by encoders. He said, for example, Code Finder or 360 Encompass. I wasn't familiar with those technologies. Do you guys know anything about those?
I really don't. I don't know if those are platform. I mean, direct can be implemented in anything. I mean, it really is at its base. It's just a protocol for creating SMIME messages and then sending them over an HTTP transport. If you look at like the reference implementation, and I think Keith Boone actually did this. He took some of the documentation that was published for the reference implementation and said, okay, I just want to put a bare bones direct implementation up. What do I need from the API? And it's just as simple as I created the SMIME message by having my own certificate. I did dynamic discovery of somebody else's, and I sent it over a Java Mail API. At the bare bones technical level, I mean, that's it. I'll leave policy out of it at that point. But I said in theory, you can embed it anywhere you want.
Yeah, I think CodeFinder and 360 and Compass, which I'd have to do more research, but I think they're more coding tools that go through the data and choose the code. So it's probably not as applicable. I think it's more, but it could be for EHRs, it could be for PHRs, it could be for population health, it could be for any personal application, right? I mean, I think you could even create imagine we created an engine which motivated you to be healthy and wanted to be able to grab your health information from an EHR, from another source. You could use Direct to enable that application, correct? And pull in the data. Would that be an implementation that would be reasonable?
Well, you've actually hit on an interesting use case, which is really around using it as not so much for a transition of care, but just as a mechanism to get clinical data into another platform, another application. So we're seeing it actually beginning to be used in chronic care management. It's an effective tool to be able to actually enroll patients and get CCD information into the platform in which you're managing them. We also see it feeding population health analytics. We've got companies now that are beginning to pioneer really just digesting the content of the CCD for actionable information. Ultimately, that may take the form of a much broader analytics database, and we can do deeper mining, but there's a tremendous amount of value in taking advantage of what amounts to low-hanging fruit in terms of leveraging the CCD content. So yeah, I think you're right. There is a mechanism just to make this information available for new uses. And I tend to think of those uses as being population health or value-based centric, but there's others as well.
Yeah, even the consumer-driven healthcare that we talked about before. Chuck Webster at Wareflow, he asked the question, tell us more about the encryption. And, I'd extend that even farther and say, security is a major issue in healthcare. So, is Direct Project secure? Is it, for some reason we think fax is secure. Are we going to apply that same principle to direct messages? And why is it secure?
So, on the security, it's only as secure as somebody implements it. So the what's called the applicability statement, which is really the spec, it says here's how you secure a message. So it is SMIME. It's doing encryption using whatever you feel is an appropriate key and algorithm. So you're really as strong as what you're using for your encryption algorithms. And there's some very specific things in the spec that says here's what you want to use. Above and beyond that, and this is where I talk about the trust aspect on the policy comes into play. Are you going to do exchange, even though you followed all of the protocols and everything that you've secured with, where nobody's going to break in and can't brute force your message? If you start doing exchange with somebody who's just running one of these out of his garage with an open firewall that anybody gets in, what are the chances somebody's going to come in there and start breaching your private keys and everything else? At that point, once you get the keys to the kingdom, security's thrown out the window. So the transport itself and the protocol is very secure. It really comes down to the implementation and the policies for implementing when you really want to talk about security.
So the foundation is as secure as anything else that we do in healthcare with EHR or other things. But, as Ryan says in the chat, he said, like everything, there's a whole human layer to security that, the human is the weakest point.
Absolutely. I 100% agree with that. We can go a whole nother conversation down, with security breaches, but the vast majorities are social engineering type breaches and not so much in the security protocols themselves.
Interesting. So Chuck has another question. He said, do you know of any workflow management systems or BPM style orchestration platforms that are generating, routing, and consuming direct messages? I guess the real core question, because I think Chuck would be the expert on which EHR platforms are workflow management systems. He might argue none of them. So if that's the case, what other systems outside of EHR are using direct messages or the direct protocol?
Well, certainly I think you can think about, as we talked about before, our referral and transition of care platform, like we do in Infina Connect, as leveraging that capability. And that actually turns out to be, both a driver for greater use of direct, but also an ability to use it for workflow reasons. In fact, I would even say that we didn't start out to solve an interoperability problem as much as we started out to solve a workflow problem. And it turned out the direct was actually the mechanism that played very, very well into that to enable it. So yeah, we actually send a lot of messages that you might think of as internal routing, but really they're enabling a better workflow by popping that information, for instance, back into the EHR, even though they have access to it within the application. In some cases, to incorporate that into the patient record is easier by routing it back in through the EHR's intake mechanism.
But you're still routing EHR to EHR. I mean, are we routing to HIEs with direct now, or are there other systems that want it? I guess we're doing it to some of the blue button systems and things like that. Any others?
Well, sure. HISPs are intermediaries, and Julie could talk about that, and Greg could as well. There's intermediaries as well, just in terms of delivering the information. HIEs are one of them. We serve as such an intermediary as well. But yes, there are those that really serve the mechanism, almost like market makers, right? We're gonna get your message there, in the best way possible.
Interesting. It starts me wondering about, what's the future of HIST? Are they the future ISPs of healthcare data exchange that they'll have to be regulated and have to be controlled since they'll hold the keys to the kingdom of exchange? Or is that a concern? Julie's shaking her head. What do you think?
Is it a concern that they would be? I think it's a confidence booster that they would be. Maybe not necessarily regulated, but accredited as we are now. The purpose of review and in-person visits by auditors is to give everyone in the network confidence in the exchange that we provide.
Yeah, and I'll add on to that. A lot of the things that you see out there in terms of certification of use are really around the technical aspects of it, and not so much to the policy, although they just say you do some type of policy. On the HIST side of it, from regulation, we've never actually seen either from the technical side or from the policy side. It's been Senate transitions of care. Fortunately, what we've seen coming out with the regulation for 2015 certified EHR technology, there's actually now an entire criterion in there that HISPs have to get. They have to get certified to say, yep, we do edge protocols, we do X, Y, and Z. So you're starting to see more of the certifications at the HISP level as opposed to just a workflow level.
So we have another question from Inophile02, KN02. What about using direct to deliver HL7 based results and start removing heavy and expensive interfaces? Deliver a lab result via direct into the EMR and let the EMR handle accordingly.
I'll actually tackle that one because that was a use case specifically that drove the implementation guide for notification delivery, and I speak very authoritatively on that one. Absolutely, you could use it. One of the big things with lab results delivery was around CLIA requirements of level of service and handoff and delivery to final destinations. Direct does have implementation guides on top of that actually do meet CLIA. CLIA actually signed off on this for the lab side piece of it. So we do meet those regulations that we need to do for some of these other heavily regulated workflows where you do need a higher level of confidence in your messaging.
Interesting. Well, we're approaching the hour. Any final thoughts on Direct and Direct's future? Mark, you want to start?
Well, I just think we're at the beginning of this, or maybe we're at the end of the beginning and the beginning of the mass adoption phase. Either way you want to look at it, we look at this as a very welcome capability. We hope that there continues to be great progress in terms of solving some of the other issues around the directory and around ultimately, patient identifier information. We think that also is an enabler. But that said, it doesn't stop us from taking advantage of what we can do today. And that's really kind of our orientation is, practically speaking, we can do a tremendous amount today to improve the exchange of clinical information, the exchange of coordination of care, We can do it electronically, and really that's why we're so excited and enthusiastic about, the steps forward.
Excellent. Julie, what do you think? Final thoughts?
Final thoughts are, I think it's really encouraging to see the teamwork that we've been a part of with Direct so far. It's a really interesting idea that all of the operators that provide this service regularly talk to each other and participate in testing the robustness of their platform's collaboration together. It's a reliable, scalable way to offer a service for exchange of healthcare data. So I would just conclude really optimistically about continued growth of Direct, and I'm really excited to see the innovative applications built on the platform.
Well, I mean, I think Julie's choice to go all in fact, her whole family went all in on Direct. Her and her husband run EMR Direct. So obviously you're passionate about it, and grateful that we could have you here. Greg, final thoughts?
Yeah, so my final thought, and there's a hidden piece, and Direct is really moving in a great direction. They're going to see a lot of adoption, but don't get held up on reasons why you can't use it. One of the biggest things I hear from a lot of folks, well, Direct, I can't use it because there's not a directory. I say back to them, can you not use email? How did we talk to each other, John? Did we do it over directory? I always like using there's a time and place where directories are going to be useful, but they're not necessary. I always use the analogy on Snapchat, the 12-year-old girl analogy.
Uh-huh.
How many teenage girls out there do you see where they say, well, I can't use Snapchat to talk to all my friends and create a network because there's no directory? If 12-year-old and teenage girls can figure out how to communicate without a directory over an endpoint, I think folks can figure it out in the health IT space. You know who the folks are you need to talk to. I think you can figure out how to get their direct addresses.
Excellent. That's great advice. It kind of goes back. How'd you get their fax number? You
Right.
called them up and asked them, right? So, luckily that's proliferated, and now they put it on their website. One day, which I think Julie and I talked many years ago, we said, when will the direct address be on the website? Mm-hmm. Maybe this year we'll start to see that happen in much larger numbers. Thanks so much to everyone for joining. We'll wrap this up. We're at the hour. Our next Healthcare Scene interview is going to happen on Monday, December 14th. We have a really good Blab video interview with Mandy Bishop and Ashish Patel. We're going to talk about healthcare data sources and what can you do with all that data. So join us then. We'll also be posting this to YouTube, posting it to healthcarescene.com and the network of sites. Thanks so much to all our panelists and your expertise, and we'll do it again.
Thanks, John.
Thanks, John.
And I'll try to figure out who my secret at Meyer is at some point. But
hands-free.
I think we know who your secret at Meyer is. It's who are you with? Snow White.
There we go.
Yeah, Snow White is really happy to be there with Mark, I guess.